Okay, well, we will now turn it over to our last speaker of the day, who is my boss, the director of Branch 1 in the Office of State Cooperative Programs, to kind of finish us off for the day. And she is live and in person this time, so I will welcome back Liz O'Malley. Liz, take it away. Liz, you're on mute.
Sorry, I was double muted. Can you hear me now?
I can hear you now.
Great, thank you. So I see the participants dropping because it's 4 o'clock, so I'm going to make this quick, but good afternoon, everyone, and I hope you've all enjoyed the seminar so far. I only wish we could all be in person. I was kind of hoping after year 2 that we would be in Alabama, being, celebrating the seminar together this year. But earlier today, I was looking at the seminar numbers and there were 3,100 people registered. And I couldn't believe that. 3 months ago, we were not even sure we were going to be able to pull this off. But somehow together we did that. And I just want to say thank you to everyone and kudos for pulling this off to our work group. And I want to thank everyone for participating and staying till 4 o'clock today. Next slide, please. So this is my favorite part of the seminar, and I know I only have a few seconds to do this, but I wanted to acknowledge some of the achievements of really big significance this year. Annually, the Fda Awards Program recognizes noteworthy accomplishments and contributions of individuals and groups that have helped the agency meet its mission of protecting and promoting public health, both on a national and an international level. Recently, about 65 individuals from Mecklenburg County, the North Carolina Department of Health and Human Services, and Charlotte-Mecklenburg Emergency Management were selected to receive an honor award from the U.S. Food and Drug Administration for their exemplary collaboration between state, local, federal agencies to develop and implement critical operational plans for maintaining food safety and defense at the 2020 Republican National Convention. As many of you may know, COVID added a new level of uncertainty to the convention, as well as many, many challenges. But everyone involved stayed very flexible and they stayed focused to the mission. So I want to congratulate and thank everyone for their contributions. You were all very deserving of this recognition. I also want to thank everyone for their contributions to the Food for Thought newsletter that Cameron Wiggins has pioneered in his jurisdictions. This is a fantastic newsletter that allows the local, state, tribal, and territorial retail food protection professionals in his jurisdictions to share and highlight what they've been doing in their communities, as well as learn about national and regional events. I really would appreciate if others would start to contribute to this newsletter because all the feedback we've gotten is so positive. If anyone is interested in writing an article or just submitting something that's going on in their jurisdiction, please reach out to Cameron. Even with all the setbacks brought on by the pandemic, many of you continued to move forward on your progress with the retail food program standards for the last 19 months. And for that, I truly applaud you. I would like to highlight a huge accomplishment in the recent year. Wake County completed their 3rd data collection of a 10-year risk factor study. Congratulations to them. And lastly, I want to acknowledge Donna Winucci, with whom many of you have worked. Donna was recently recognized for 20 years of service with FDA. And lucky for us, all of those 20 years have been with the retail food specialist team in the Southeast region. And I, for one, am very grateful to work with Donna every single day. So congratulations. Next slide, please. I'll make this quick, but I think that this is a really good slide after the presentation that Dion and Marianne just gave. We heard a lot this week from Frank Yanis and others talking about experiencing a food safety revolution and the need to promote a culture of food safety. If you recall, Frank said, we will probably see more changes in the next decade than we've seen in 20 or 30 years. We will see technologies that we've never seen before, new and reformulated foods. We will see business models changing and data being used to improve food safety systems. We'll deal with issues such as sustainability and food security on levels that we've never dealt with before. And currently we are seeing consumer interest, collaboration, and funding in retail that has been unprecedented. But what I want to say to everyone that's still on is that we shouldn't be intimidated or scared by any of this. When I started working in public health 30 years ago, I never dreamed I'd see some of the things that I actually have seen. We've seen tremendous public health improvements that were laughed at when they first were talked about. Some of them were scoffed at and no one wanted to hear about them. When I was a kid, no one knew seatbelts. We got in the car to go on a family vacation. We were thrown in the back of a station wagon. Now kids would never start a car without putting their seatbelt on first. And how about sunscreen? I'm 100% Irish if you haven't been able to tell by my last name, O'Malley. But how many of you burned to a crisp as a kid? Now my kids apply it every morning without me ever having to tell them. And what about smoking? When I first started in food protection or in public health, people walked around the offices smoking. And we'd go into restaurants and we would be asked smoking or non-smoking section. That's something of the past. And related to food, I remember when bare hand contact with ready-to-eat food was the norm. No one ever thought guidance or enforcement of no bare hand contact would ever come to be. And now it's an item in our data collection with pretty high compliance rates. Public health officials changed our behaviors and changed the behaviors of our society and our culture, but not without a fight. But sometimes I wonder how we did that. How were these behaviors changed and why were we so successful doing that? And last night I came up with a list of a few thoughts. Number one, we had the right ideas and the right messages. They were public health focused messages. We had the science and the data to support the changes, and public health officials built systems to help get the messages out there. Many of these movements started at the local level. They were grassroots in nature. There was funding made available and no one worked alone. We collaborated. Public health officials were able to change people's attitudes and behaviors towards all these public health issues. We can do this again with food safety. It's a really exciting time to be working in retail food, and we need to embrace what's happening, not be scared of it. We can't continue to do things the same way, and we shouldn't want to do things the same way. We should want to evolve. We need to make the ideas and words we heard this week, whether it was from Frank or Dion or any of the presenters we heard, become our behaviors. And we need to make our behaviors become our habits and our habits become our values. This will take time and commitment, but this is how we will cultivate a culture of food safety, and we will do it. Just change the slide, please. Thank you. So thank you to all the great presentations. I really, truly enjoyed every one of them. And I hope to see you next year, not on Zoom.
Thank you, Liz.
Thanks.
We have one more item that we want to do before we close out today. This is what I love about the Southeast, that, we come together, we enjoy each other, we connect, we share. What other presentations can you talk about Snoopy and Transformers all in the same day and have a great time doing it? But we also, we're there for one another when we're very close. And so we wanted to put together a tribute to one of our very own. And I just want to share and read it with you guys. Today, the former Southeast region of the FDA Retail Food Protection Seminar would like to honor one of our very own, Miss Vakisha Brown Timbley. As you know, Vakisha's dedication to protecting, promoting, and improving public health has been exemplified through her professionalism, leadership, environmental health minority internship program that she was a part of, and program quality improvement initiatives. Vakisha devoted over 16 years to advancing public health and food safety in Florida as a program consultant, and later as a program manager supervisor with the Department of Health. On behalf of the former Southeast region, we recognize and honor our sister, Vakisha Brown Timbley's service and dedication to in support of this seminar over the years, and in her work alongside of us in promoting public health and reducing the incidence of foodborne illness. I share in Liz, what Liz said. Thank you. See you next year. And thanks again for everyone for staying on to finish up with us. And hope you enjoy the rest of the conference. Thanks.
Thank you, Kevin.